Now my privilege to invite our president of the SAO, also multiple hats that he wears. He's the president of the Indian ROP Society and the World ROP Council and the Asia Pacific Pediatric Vitreoretinal Society, but today he will fulfill his role as
Thank
the
you very
SAO
much,
president.
Anand.
Dr. Azad.
We are going to, we had a good presentation, and I'm going to tell you about the ROP screening program, considering India and considering other countries where there's a large population. And we have to reach to the most rural area. And if we talk about that, the technology comes to our help. Yesterday, we had a session on the technology and education, and where we discussed about the availability of different types of the advancement in the technology. Online platforms are there. The telemedicine approach is there. That's all this we'll be talking about. And the other reason why I chose this topic was that now I'm attached to a very big eye hospital. It's a high volume surgical hospital where more than 1 lakh surgery is done every year, and 700 standalone eye beds, so you can understand. And then they have satellite hospital. We have around 20 satellite hospital, and that is in the state of Bihar. And Bihar, is a state, although recently there have been a lot of developments, but then still there are far-reaching areas where the services are required. इसको चेंज करो यार, चेंज नहीं हो रहा. नहीं, I can change from here? Okay. So, there are various estimates are there. 10% of the global estimate, India accounts alone for 10% of the global estimate. And children developing severe ROP, 5,000 developing severe ROP, and 2,900 surviving with visual impairment. These are figures, these figure will vary, and because time to time. And the economic burden of blindness and visual impairment due to ROP is estimated to be a net loss of 845 billion Indian rupees in gross national income. So it's a huge amount of money, which is involved there. And what should be the strategy for scaling ROP screening program? And as we often talk about the blindness program and reaching to the unreached population, that there are 3 factors which are very important. One is the accessibility, the other one is the affordability, and of course, if we want to make it accessible and affordable, we have to sustain it, because sustenance involves not only the methodology and the manpower, but also involves a lot of finances. And in India, the ROP program, screening program, is linked with National Program for Control of Blindness and visual impairment. And now it is linked to it is called RBSK, and it is in Hindi, Rashtriya Bal Suraksha Karyakram. Means basically it is, the children health, protection or healthy program. That is what is it. And in NPCB, when I was advisor to Government of India, that time I think it was 2011, Anand? 2011, we put it in the ROP in the National Program for Control of Blindness. And we had a national task force on retinopathy of prematurity. You can think of India and having a national task force there. It was a big thing there. And we continued with this program. And we developed the guidelines and other literature and all that. And I mean, the program is still going on, but this program is going on with the Rashtriya Bal Suraksha Karyakram. Now, what are the strategies for screening if we want to do it in low resource setting? First thing is the capacity building. So you need to have, people who can, diagnose or who can detect or who can even, take the pictures as it is done in telemedicine. And we need to integrate it with the neonatal care services. And I like to tell you here that we had a lot of these workshops. I think in year 1999, 2000, we had a workshop with the Ministry of Health and the WHO, and we had the concept of paired workshop, and where there was integration of neonatal care services. We invited the neonatologist, and we had the ophthalmologist together. And in fact, I say that the ops gynae people should also be there. It should be, a joint approach, because I say that this premature babies, they come from the gynae or ops department to the neonatologist, and from neonatologist, it is a gift to ophthalmologist. So we have to handle the gift very well. And then, of course, most important thing is awareness program. As I told you, we started awareness program 1999 with Government of India. Then we had a lot of these site saver workshop, almost more than 20 workshop. And then with the workshop with the Orbis International and many other organizations, we had workshop with the government in different states. India is a big country, and there are 25 states. And some union territories are there. So a lot of awareness is required. And then we need to have the telemedicine, because to reach the far-flung areas, that is very important. At the same time, it has to be cost-effective and, of course, sustainable. And very important is the monitoring and evaluation. More often it happens that the program is there and the program is launched. And after that, nobody looks to that, what happened, and also the evaluation. So talking about the human resource strengthening, we need to have, training for the neonatal nurses, to the pediatricians, general ophthalmologists. And in fact, we did a very interesting study where we trained the nurses, neonatal nurses, and the residents, and I think these two people, and we trained them for 3 weeks about, ROP, both the theoretical and the clinical part, and we, put them for the examination to detect ROP. And we found that the acceptability and the diagnosability was almost to the extent of 80, 85, 90%. So if you have shortage of the experts, ROP experts, we can definitely induct the nurses, the pediatricians, and the general ophthalmologists. I have not mentioned here the name of the study, but it was in Indian Journal of Ophthalmology. And then awareness regarding risk factors, although she has presented about the multiple gestations and the various risk factors, more or less any study that has been done, the more important risk factor remains two, the gestational age and the birth weight. And the other risk factors here, sepsis is very important. We have, respiratory distress syndrome, stay in the NICU, blood transfusion. All these factors will remain same, maybe a little bit this side or that side. So, but more or less, these are the risk factors. And the capacity building definitely is very important. And as we talked about the integration with the neonatal care services, which is very important. And here there is a point. The point is when we do the screening, we need to do the screening in neonatology department, because the child is, the infant is very, in a critical stage, and it's very difficult for the transportation of the baby from there onto the this eye department, and in that way, it's better to do the the screening there. I think most of us are doing screening in the neonatology department. In fact, many people, they keep the laser also there in the neonatology department, and when the need arises, then you can do the laser itself there. And that is very, comfortable, and it's very easy to do that. This is very important, community awareness and parental engagement. We have time, no? Yes, we have many time, a lot of time. So this is very important, awareness and the parental engagement. And in this, I'll tell you that those who are engaged in ROP management, the eye from outside looks normal. And when the eye from outside looks normal, the parent do not have the idea what is happening inside the eye. And then, when they come to you, they come with lot of hopes. We have had babies, who were in stage 5, and they were not screened earlier. They come to us, and then when we see and they come with lot of hopes. They think that everything will be all right. I have come to YGU, I have come to Anand, I have to come to Supriya, and I have to come to Domenico, and because they are, the experts, everything will be all right. So parental awareness is very important, and that's why the awareness program and the workshops are there. We have, as I told you, we had several workshops. Even now, despite, I think from almost now, how many years? 25 years of awareness program in India by each one of us. Despite that, we are getting stage 5 cases. So this is very important, and make parents aware about the risk factors, which are very important. And this is something very important. And here I would like to point to you another thing, that of course the pediatric fundus camera is very costly, but then it is a big tool for making the parents aware. When you show them on the screen that, look, this is like this is what is happening inside the eye, then they become aware, and then they are more concerned. And then the telemedicine, using the technology to reach far-flung areas. And in this, telemedicine has come to our rescue. And there are various types of these telemedicine approach. And it may be mobile-based apps, or maybe regional screening hubs, or there may be now a lot of these AI-assisted screening tools to reduce the workload of the experts. And we need to have, especially, I think most of the countries, not only in India, other countries are also, finances are a big issue when these babies come to you. And laser therapy is less expensive, requires expensive equipment, but when it delivered to the babies, it is less expensive. And in India, I think a lot of these Indian companies, they are making the laser machine, and the local laser machines are as good as the machines which are from abroad, and they are less expensive, and therefore you can do the treatment at lesser cost to the patient. And again, coming on to anti-VEGF injection, which is become a very ubiquitous mode of treatment. And sometimes it is being used indiscriminately also, which is unfortunate. And we need to keep a check on that. But although it is difficult, but we need to have some kind of mechanism to control and regulate that. And as this anti-VEGF is concerned, and we talk of the cost, definitely Avastin comes to our rescue. And screen and treat model is, another way for the immediate intervention in infants for those who are at high risk. And again, as I told you, the finances are very important, and we need to an advocacy and talk to the government. We have Indian ROP Society here, and which is a very strong group now. And earlier we started in 2016 with how many members we had? I think 34, 35 members. Now we have almost more than 250 or maybe around 300 members we have. And we are, because if you have a group in the country, you can, advocate the requirements, and you can force the government to make a policy. And many places, the government is itself, taking up this program, as in India, there is a national task force. I believe there is in Thailand also, there is some government has taken up this issue. I was in Thailand, I think 5, 6 years back. And in Philippines, there is a group, ROP group, in Waichi place, Taiwan also, I think, there also. Like that, those groups are there. Basically, these groups are to, form the policy, form the guidelines, give the support in terms of, screening, and in terms of early detection, in terms of, suggesting the correct mode of treatment. And of course, there are a lot of agencies, which can support you with the funding. And in India, there are some foundations are there, and also the corporate houses are there. So corporate houses, there is a provision for CSR. So from CSR, if you make a presentation, then you talk to them, they'll definitely help you and give you a financial support. And as I told you, monitoring and evaluation is very important for any program to be successful. We need to monitor it constantly. Regular audit should be there, and we should have a cost-effective models, research on cost-effective models continuously, so that we can make it more, the program more effective and more far-reaching. And when we talk of the telemedicine models, Arvind and LV Prasad, definitely they have this model, but I have a person here who is the person who is responsible for KidROP, Karnataka Internet Assisted Diagnosis of Retinopathy of Prematurity. And this is a wonderful work, and the KidROP has provided free screening and treatment for ROP for all government hospitals in the state of Karnataka since 2007. It's all because of this guy who is sitting here, and that is the reason he is with me. I'm with him, the other way around. So the key features of KidROP is, of course, he is the right person to speak on that, but then he has allowed me to say a few words about that. The telemedicine-based ROP screening program is there, where he uses wide field digital imaging. Earlier he used to use RedCam. Of course, most of us were using RedCam. But now, because of the Indian manufacturer is there, and he's making the pediatric fundus camera. This is called as NEO. And NEO is as good as RedCam. I'm not advocating for any company, but for the sake of cost, I am just saying that it is as good as RedCam. And this is very good tool for screening of premature infants in rural and underserved areas. And images, the process is that images are captured by trained non-ophthalmologist, by technician. And then it is transmitted to the experts for diagnosis, like Anand and a few of his own colleagues. And then, action is taken. And then local healthcare providers like nurses, are trained to capture images and provide preliminary evaluation. And of course, the diagnosis is and guidance is given remotely for these babies who are required to go for treatment or maybe for follow-ups, whatever it is there. And he has been able to, collaborate with the National Health Mission in his state, and he provides free treatment and screening and treatment to infants in government hospitals. So most important is early detection and the timely treatment. And of course, the window of treatment is very small. If you detect that some baby, some infant needs treatment, then the window of treatment is, or window of waiting is only 72 hours. So within that period, you have to give the treatment. And this is the impact. The reach is up to 177 neonatal units across Karnataka and 9 other states also. This program is running. And there is a significantly reduction in the blindness because of retinopathy of prematurity. And inspired by this model, the other states, Maharashtra, Tamil Nadu, and Kerala, they have been able to adopt the similar models. And now they are, using AI and automation for better image interpretation. So I think, so in summary, 3A strategies: accessibility, affordability, and adaptability. We have to have good screening tools, capacity building, and low-cost equipment, and integration with neonatal care is very important because without them, it will be incomplete. And community participation and counseling is, of course, the most crux of the management of retinopathy of prematurity. And telemedicine approach is something which is very much required for a country like ours and many other countries where the healthcare is not being able to reach up to the rural areas. So thank you very much, and thanks to everybody.
Thank you, sir.